Thank you very much. At the outset, let me tell my acknowledgements and thanks to the organizers of the Global Ayurveda Festival 2021 version. It's a wonderful thing that during this pandemic period also we are able to transfer the message of Ayurveda, the knowledge of Ayurveda to all the people who are learning it and then propagating it also. There are very good enthusiastics. I know that very senior teachers will be there. My regards to all my teachers who taught me Shalya Tantra, right from Dr. G.S. Raju sir, Dr. B. Jayachandran sir, and Dr. Mohanlal sir, and late Chandrasekharan sir. It is a wonderful occasion also to have my seniors, Dr. T.S. Jayan, Dr. Shivakumar, Dr. Matthews Joseph, and Mayank from Dr. Jiku, along with me in this forum. The mission was that I believe that we have a lot of strength in Ayurveda, in Ayurvedic orthopedics, with Marma Chikitsa very popular in Kerala, which has, I believe that it is losing its roots, but now it is time that we should be catching back. We can very proudly tell that we are not just treating conventional, which can be managed conventionally, conservatively, etc. But we are having a very good role wherever there is a gray area in the modern orthopedics and orthopedic surgery. So I think all my colleagues will be agreeing in that matter. Let me share my presentation, which will be dealing with the Ayurvedic and Marma management of the spinal conditions. I think are the slides visible, sir? Are the slides visible, sir?
Yes.
Strategies of Ayurvedic management of spinal conditions with special reference to IVDP, some thoughts. So I am very glad that Dr. T.S. Jayan and also Dr. Shivakumar has gone in depth in the all the aspects, treatment aspects, and very clearly given a picture of the subject, although in different situations like the hip and the knee. It is very good that they have given the picture, and it is easy for me, and I will try to stick up with the time slot allotted to me. Now, you can see that in this presentation, Ayurvedic perspectives to diagnose spinal conditions with special reference to IVDP and strategies of treatment will be discussed over here. There are two things that once we realize that all what has been mentioned in the new textbooks, or when we talk about the modern orthopedics, they are all lying between the lines in whatever the acharyas have told. And I always tell that Dhanvantari Samaratha Susurdayascha Madhyama Asmadacharya Paryandam Vande Guru Paramparam. That is the Paramparyam we are having. To understand the clinical presentations, pathology behind them, there are various presentations of the spinal injuries and spinal conditions, cold orthopedic conditions, which we get day to day in our clinical practice. The clinical presentations, how they come. Whatever be the spinal conditions, there are a few symptoms and signs which are exhibited, and that we will be talking about. Pathology behind them, treatment modalities available that has been discussed in detail pertaining to the spine. We will be discussing classification of patients, selection of treatment procedure, and that is one of the most important thing which I believe that there is a principle which is taken care of whenever we are selecting a treatment procedure. I think I will be able to highlight on that, and application and evaluation will be done. Clinical presentations, generally when we take into consideration, we have Griva, Prishta, Kadi, Graha. Many patients present with neck, upper back, low back, catch or a spasm. So we can see that that is the presentation as far as some of the patients are concerned regarding the vertebral problem or the spinal problem. Some people have Griva, Prishta, Kadi, Ruja. That is neck, upper back, low back pain. They complain of backache. Then there is a Gridrasi or the sciatica. Then there is a condition called Khalli mentioned by Vagbhada, where you know that very Tivra Ruja. Gridrasi. In Gridrasi and Vishwaji, that is called Khali. Then Bahu Shula or upper arm pain is another condition. And then Urashula or pectoral ache, that does not, it is not related to any Hridruja or anything, but at the pectoral region radiating from the neck. And then Ababahuga or inability to lift upper limb or loss of ability to lift the upper limb. Vishwaji, shoulder hand syndrome, similar to shoulder hand syndrome. I just put it because it will be good for discussing such things. And then Manya Ruja or neck pain, Manya Stamba, torticollis or wry neck. And then Bahu Hasta Sukti, that is numbness of arm and hand. Bahu Hasta Daha, burning sensation of arm and hand. Now we can very well realize that whenever a complex structure of the spine or the vertebral column, I am not going into the anatomy and physiology of that because I know that you are all aware of that. It is a very complex structure. Every point of the backbone or the vertebral column along with the spinal cord inside and the nerve roots coming out is a marma, is totally a marma we can call. And we can see that which are all marmas related. When we come to Tamil marma, we can see that there are many more points which are told in relation with the spinal cord and the vertebral column. Now we can again have Saktipada Sukti or Harsha, that is numbness of the leg and the foot. Saktipada Daha, burning sensation of the leg and the foot. Kubjada, kyphosis, including scoliotic conditions, lordosis or just compensatory listing as in intervertebral disc prolapse. Then Kanjada, that is limping, very clearly explained by the previous speaker. Then Pangutva or gait disorder, when both the knee joints or both the legs are affected, what sort of gait disorders they are having, that Pangu, they become totally unable to walk. Kunitva or contracture or spasticity, which we see in many marma conditions like affecting the long-standing neurological conditions which are affecting the vertebral column, like what we see in Manibandha and Kurpara, Marma, Abhigada, etc. Now, Vyadhi Moolasthana and Dushyas involved, basic location of the disease and tissues involved. I remember my teachers, Dr. N.V.Sreevaths and all, whenever something it is for there may be some people who may not be understanding our Ayurvedic terminology. That's why I've tried to relate it with the modern terminology also. Prishhtavamsha, the vertebral column in general, we know it consists of the 33 vertebrae with the cervical, dorsal, lumbar, and sacral and coccygeal components. Asti or kasheru, that vertebral bone, is a particular type of bone we understand, and then each vertebral body, each vertebrae has its own features. Cervical vertebrae has their own features. According to the dharma which they have to do, the dorsal vertebrae has particular features, lumbar vertebrae has particular features. Tarunasti or the cartilage or the disc, we see that it is the most complex structure in the body where every vertebral body is, every disc is sandwiched by two vertebral bodies, and they are the basic components which help in weight bearing as well as shock absorbing and whatnot. Sandhi Achala. Now we have whenever we are talking about the vertebral joints, there are places where they are semi-mobile, they are immobile, and they are mobile. And we know that the junction of the cervico-dorsal vertebrae and the lumbosacral vertebrae are the most liable because they are the junctions of the vertebral column where the movable part of the vertebral column joins with the immobile or semi-mobile part of the vertebral column. Now, mamsas and peshis, we know that it is not a single structure. The whole vertebral column is supported by the longitudinal muscles either side and all the muscles of the torso and the back of the body attached to the vertebral column. We see that the ribs are attached to this one. So mamsa peshis, kandaras, tendons, fibrous sheets, and ligaments also we can include under this, and snayus, the nerve, including their tight, taut sheets or the cords which we call. So this is the structure of whenever we are talking about vertebral column, many times we stop thinking after the bones. But as Ayurveda is concerned, we talk about the anatomy along with the physiology. And so it's very important to consider all the other structures which give the particular function of the vertebral column possible. Now, again, we can see that Griva, Prishta, Kadi, Tirga, Shroni, Pradesha. We will be talking about all the conditions, or we have to consider all the conditions where, say, neck or the cervical region, upper back or the dorsal region, mid back or the dorsal lumbar region, lower back, the lumbosacral region, pelvic and sacrococcygeal areas. I think we get the picture now. I have not included any diagrams because you know that the imagination you have, and you know that. Now, Srotas is to be considered as far as Ayurveda is concerned. Whenever we are talking about the treatment of aspect of it, we know the symptomatology now. Now, Dushti of the Mamsava Srotas, Medova Srotas, Astiva Srotas, and Majjava Srotas is more predominant here. We know very well that it all starts with the Agni and the Rasa also. So, keep in mind these Srotas also. Now, dosha involvement, mostly we talk about the doshas involved, the doshas are involved, but Vata and Kava are involved more. Now, one wonderful thing regarding the function of the spine or the vertebral column is the flexibility and stability are the opposite attributes which coexist in the backbone as a total structure. We know that whenever we have to treat a patient, we have to improve his flexibility, lumbar or the spinal flexibility, and we have to restore give back the stability where one can tell that I have a backbone with which I can stand straight and look straight. So these two attributes are there, and how the soft tissues connecting the bones attribute for the flexibility, and how the stability is also maintained by their proper elastic nature, that we have to understand. And that is where I think Ayurveda is very, very, very successful, where the modern medicine has a gray area. This is responsible for the normal function and also normal presentations of the spinal cord vertebral conditions. Restoration of this is aimed in the planning and execution of a treatment of a vertebral or a spinal case or an IVDP case. Here I am just taking the intervertebral disc prolapse as an example. Now, Nidana causes, you know, the Nidana of the Vata Vyadhi, all the Nidanas you can take up, and that lead to some conditions where the, I told about the symptoms, which I told earlier can occur based on the Dushti which has happened to the Prishhtavamsha and its aligned structures. Nidana of Bhagna, that is traumatic or Sadhyavarana crosses are also there, which has to be considered when the spine is dealt with. Now, they can be again classified as internal Bahya, external Abhyantara causes, Nija or the endogenous causes, Agandaja causes, etc. Now, other etiological factors, if we look at from another aspect, is that the congenital anomalies are Sahaja, Abhigadaja trauma, Chayaja degenerative bone diseases, degenerative tendon diseases, degenerative ligaments, whatever, where there is a degeneration or spondylolysis, we talk about conditions like that. Shophaja conditions, where any inflammatory condition of the surrounding tissues or any inflammatory disease, even some conditions like the TV spine also can be considered over here. The Attvagni here, this also from the as a Pratisamskarna we can add. We know that whenever there is a Attvagni failure, then the Asti, which has the Dharma of Dharana, will be affected. The Majja, which has the Dharma of Purana, will be affected, and that will be affecting the total function of the spinal segment of the body. So endocrine factors, now we know too much of these endocrinal factors are coming into play because of either wrong habit of eating or wrong nutrition or viruddha aharas, etc. So marma involvement, lakshanas of asti, sandhi, snayu, marma, chada. You can see that now those who want to go in detail should go and refer what are the lakshanas of asti marma, sandhi marma, snayu marma, and chada, which are happening. All those lakshanas which are similar to what I had mentioned as in presentation will be happening. It is a Vaikalyakara Swabhava, debilitating, deformity or handicap causing, indicating predominance of Vayu and Soma. We know that whether it is a fall from a height or whether it is due to a repeated stress injuries, which Dr. Matthews will be talking about, or due to any occupational factors, so much of man hours is lost because of problems of the vertebral column or simple backache and other conditions. Now, Prishtvamsha Ashrita Marmas, which you see all the definitions of these Marmas, they will be told that Prishtavamshiyo Ruvayadaha. So that is Kadiga Taruna is involved, Nitampa is involved, Ukuntara is involved, Parasha Shanti is involved. You have the involvement of the Amsa and the Amsa Falaga also. Even some other Marmas also you can tell, like Brihati and other conditions, other Marmas also can be considered. But here, the most important as far as IVDP is concerned is Ukuntara, you know. It is, I am just showing the light, and you can go and if details are required, we know that it is all available. Vyadhi Marga, pathogenic pathway, Madhyama Roga Marga, suggests the Krichra Sadhyada. Every Asti, Majja, Marma, everything is falls under the Madhyama Roga Marga. Yapyada is the nature, difficulty for cure and continuous care is required over here. Chances for recurrence of the disease is there. Requirement of prolonged treatment is to be noted. Resultant disability is almost a certain by rehabilitation, which we can prevent or control or regulate. Samprati or pathogenesis, Kevalavada in Mamsa, Asthis, Tarunasthis, Sandhis, Snayu, Kandra. These are the structures which are related to the backbone, we have told. Kapavada Samsarga is also which has to be considered. Avarana of Pitta and Rakta, very beautifully explained by Dr. Shivakumar when he told about the Janusandhi. Then Asti Dadu Chaya and Majja Dadu Chaya has to be considered. Whether you have a lot of cases which are coming due to osteopenia, osteoporosis, and women after their menopause, so much of conditions where we have to consider, and the treatment also will be depending on such pathogenetic factors or samprati, where we try to do the samprati vigrana. Now we have to always consider samavastha, whether there is any jwara along with that, which will prevent us from overdoing things which we usually do in the name of treatment. Avarana avastha has to be considered, whereby we can remove the avarana first and then come to a situation where we treat the patient properly. For pathological events, for intervertebral disc, when we consider that, we know that there are a few conditions. There is just protrusion, there is a extrusion, there is an intermittent prolapse, or something called the scarred disc also. Here we see that if there is no annulus break, fibrosis break, and if there is just a jutting of the nucleus pulposus, then it is just a protrusion. But if there is a break in the annulus fibrosis, and that is a real bhagna of the tarunasti there, and then if the nucleus pulposus comes out, and then if there is a pressure inside the spinal cord or to the exiting nerve roots, that will cause all the symptoms which we are talking about in IVDP. Now, stages of inflammation has to be considered in the acute stage. There will be the first stage of inflammation. From that, right to degenerative stage, it can go. Dislocation or derangement is something which we have to talk about, because spondylolisthesis is one condition. We can see that slipped disc again is another misnomer. We can tell that there can be a ptosis, or there can be a little difference in the alignment of the spinal vertebral column, which can be there. And there are some conditions like spondylolisthesis, which is very common in the lumbosacral junction. Degeneration, again, which we have been talking about, has to be dealt when we are dealing with the pathological situations. Now, differential diagnosis as far as IVDP is concerned, and associated conditions which I have to tell whenever we are dealing with a back problem or the vertebral problem is lumbosacral strain, fibrositis back or lumbago, congenital abnormalities, lumbar canal stenosis, osteoarthritis, spondylosis, osteoporosis, tuberculosis, tumors, facetal arthritis, and many conditions of lumbar and cervical spondylosis, spondylitis, spondylolisthesis, etc. All these things have to come in our mind. But we have to, again, the investigations I am not going into. We know the X-ray is the basic investigation, CT is another one, MRI is the most common one. But I believe that the clinical examination by us gives a lot of message, and only confirmation can be taken from the MRI reports and other things. Because many a times what is seen in the MRI need not be evident in the patient, and what is evident in the patient need not be found in relation with the MRI reports. So that's a message which I want to give to all practitioners and students who are there, maybe because we are over-relying sometimes on these investigations, but it is our practical physical examination of the patient which is going to give the details which are required for treatment, as Acharya tells, Sukshma Samichesham. Factors determining choice of treatment: the built, whether he is heavy built or light built, strength, bala, alpa bala, madhyama bala, uttama bala, IVDP alone or associated with other diseases, occupational or not, because in rehabilitation it is very important, ambulant or bedridden, location of the Vektasthana in the total spinal cord where the Vektasthana is there. Now, selection of treatment depends on accurate diagnosis, the level of IVDP, the grade of root compression, duration of symptoms, personality of patient, their demand, their requirement, because everywhere the economical factors also come into being, and that is where a proud Ayurvedic Marma physician can tell that with the minimal facilities, with the power of his hands, with the utilization of common things as suggested by Acharya Sushrita, we can give wonderful results which can be very well compared to any modern treatment which has been given, except in very few cases. Now, Ayurvedic treatment modalities, it is treatment principles of Vata Vyadhi is taken into consideration, that is Snehana and Swedana, Bhagana Chikitsa, and what you call Anchanam, Sthitisthapanam, this is being taken into consideration. Marma Bhigada Chikitsa, including shock revival or retrieval, resuscitation is required sometimes in spinal shock situations. Then Shofa or Vrana Chikitsa, it is to be considered. Now, Asti Dhadu Vriddhikara Chikitsa is also concurrently to be taken, and these are the basic modalities. Now, as already has been told, Apatarpana, Alebana, Parishega, Abhyanga, Swedana, Vimlavana, Mardana, Upanaha, Visravana, Snehapana, Virechana, Anchana, Bandhana, Veshtana, Kabada Shayana, where we make the patient lie down very flat. Snehavasti, Kashayavasti, Kativasti, etc. can be considered over here. They have been discussed in detail. The medicines which are Murivanna, Dhanvandaran, Thailam, Marmadi Kashayas, Kuligas, Lepas, Nagaraj Leva, etc. has been mentioned. With all these things, we can do that. Now, Agni Karma is also come into being now in the last decade, where severe sciatic pain and all can be managed without painkillers by doing Agni Karma in respective places, and we can get control of the patient. Now, Samshamana Aushadhis, which has to be given for at least 2 to 3 months duration to get the complete result. In my experience, I give a treatment for at least 3 months. My IP treatment usually is of 15 days or 7 days or 15 days, followed by proper medication. And if bandhana or anything is required like that, and then they are, many of the 80% of them are back to their normal jobs. Classification of patients for, this is very important, I believe, the gist of the whole presentation. Ayurvedic treatment based on occurrence, mode of onset. So acute onset means the treatment has to be Bhagana Chikitsa, that is giving Bandhana and Sthitisthavana and giving complete rest. Marma Abhigada Chikitsa and Shofa Chikitsa, medicines related to that has to be done. Now, if it is a gradual onset, we know that it is a Nija Vyadhi, and Vata Vyadhi Chikitsa is to be considered. Gradual development but sudden onset. This is acute on chronic situation. A combination of both the above treatments will have to be done to relieve the pain and other the graha, etc. We will have to do a acute onset like of treatment, and then shift to gradual onset of treatment, that is Vata Vyadhi Chikitsa. And whenever it is recurrent, all the above, plus prevention by doing Balya Chikitsa, Sthairya Chikitsa, Asti Dhadu Chayahara Chikitsa or Asti Dhadu Vriddhikara Chikitsa, and Rasayana Chikitsa has to be considered over here. It's very important, not just by giving calcium or phosphorus, we are going to save the patient. We are going to save the patient by giving proper rasayanas like Dhanvandara Mahavarti, Gugula Tikta Gangridam, the other Rasayana Chikitsas like Karaskara Grita and other medicines which are whenever it is required. Now, options in modern medicine, we know it's rest, medication, orthosis and orthotics. I believe everybody knows the difference. Orthosis is giving the required aid, and orthotics is designing it. Remedial exercises, manipulation and massage, and surgery. Now, manipulation and massage is the mainstay of our Marma Chikitsa, and so I think I will dwell on it for 2 minutes. Musculoskeletal physical therapies are myotherapy, massage therapy, manipulation therapy, orthopedic manual therapies, which includes Syriax approach, calf bone approach, Maitland approach, McKenzie's approach, etc. And I am very sad to tell that we have not documented things, and that is why we are not having the Nadi Marma Kalari massage procedures documented. Thanks to CCRIS, which has come out with the expert committee, and the contribution is now come out as the manual on Marma Chikitsa under the able leadership of Dr. Dhiman sir. Here, I always feel unfortunate that our seniors, our doctors, our teachers' names are to be included, like so-and-so's, our Krishnan's approach, Raman's approach, etc. So, massage methods generally are effleurage, petrissage, friction, rapportment, vibration, myofascial trigger point therapy, connective tissue massage, etc. Why I am telling is that in our Kalari Marma, Nadi Marma massage or Marma massage, we are including all these things without even realizing that we are doing these things. So that is why I am putting up these things. And thanks to Dr. Jayan, who has explained on all those things, I will skip that part of that, the massage techniques, which has been the 10 different techniques and their explanation. Now I am just want to tell that in Varma Chikitsa and Tamil Varma Chikitsa, the Marma manipulations are of different types: Anukkal, Asaital, Pidittal, Nadukkal, Tattal, Tadaval, Undral, Amartal, Padukkal, Karakkal, Pinnal, Endal, etc. So these are, each and every method has a different way of performing it and different purpose for which it is performed. Each Marma point can be operated in such ways for different results, and that is being utilized in this Kalari Marma massage therapy. Now the varieties of Malayalam or the Kerala type of massages are Talodal, Tadaval, Tirumal, Tep, Udichil, Tattal, Valikkel, Chavittal, Puttal, Amartal, etc. Methods of Kacha Tirumal, Suga Tirumal, and Reksha Tirumal of Kalari Marma Chikitsa are utilized for care, cure, and rehabilitative treatments. Now, realities, most symptoms of the IVDPs and the back even are self-limiting. Give the proper the modality of treatments which Dr. Jain told. Rest if it is required, rest. Resolve spontaneously also, maybe not due to our treatments. We have to be very, very judging in that, whether we are treating a simple lumbago or a severe IVDP. Time is the healer. Power of human body to heal itself not to be underestimated. This is what Ayurveda dwells upon, of doing the Satvavajaya of the patient whenever it is required along with the Yukti Vyavastra Chikitsa, and put him back to his feet. Everything we do is to direct and facilitate this process which assists the nature. This is what Ayurveda, which is a part of the nature, a natural medical science, a natural way of living, which tells the Vaidya also. And we are proud as Marma physicians that we are able to handle many of the spinal or vertebral conditions very successfully, giving the patient a lot of relief. I take this opportunity to thank once again the honorable moderator of this session, Dr. George, my senior, and all the officials of the GAF and all my colleagues. Thank you very much. I think because we are running time, I am not going for the video of the massage, which we thought if there is any chance in the last, I may be permitted to do that. Thank you very much. Thank you very much for the opportunity.